So we're going to talk about the process of getting an epidural and kind of everything that's involved. And so we're going to pretend to give Cheryl an epidural here. So we're going to kind of put a bunch of things on her and see what happens. So the first thing is you're going to get an IV. Epidurals are known to drop your blood pressure, and so getting IV fluids can kind of help alleviate that and maybe even prevent it. So we are going to give her an IV. So we're going to tape it. I like to tape it on your arm. Okay. If they can kind of get that vein on the side of your arm, that's easier than your hand, so that like you can still move your hand around. Mm-hmm. So I'm just going to put it right here on the side. And then we're going to tape this up, and now you've got the IV pole and all that fun stuff. Okay, and we're just going to tape it right here. All right, then the next thing is a blood pressure cuff. Again, because it's known to drop your blood pressure, they're going to monitor your blood pressure very, very carefully. So, and you're going to want to put it on the opposite arm than the IV, because when this squeezes, that can kind of bother your IV. So we're going to tighten it. And they will put this on a timer, and it will just automatically go off. And when you first get the epidural, they will set it off like every few minutes, maybe every 5 minutes. And then once they're sure that you're stable, they usually will do like once every 15 minutes-ish. But they will monitor your blood pressure carefully. Okay, the next thing is, this is a monitor that's going to monitor the contractions. When you watch movies and stuff like that, you will see like the monitors, and they have like those hills. That's what that is the contractions. And so we're going to wrap it around her. So this one usually goes on the top of her abdomen. That's where they're going to monitor that. Okay. And then the second monitor is going to go kind of on your lower abdomen. And this is what's going to monitor the baby, because they need to make sure baby's handling everything okay. How are you feeling so far?
I'm feeling tied up.
Okay, so that one's down there, and that's going to monitor baby's heart rate.
Mm-hmm.
Okay.
Mm-hmm. This is intense.
Yeah, there's lots involved. Okay, this is a pulse ox, and so we're going to pick a finger, and put it on your finger. And that's to monitor mom's heart rate. Okay, so then after you've had all of this, then you can get the epidural. I would say it is a little bit of a process, especially if you haven't had IV fluids before you decide that you want to have an epidural, because it takes some time to get all those IV fluids in you. They usually want you to have 1 to 2 bags of fluids beforehand. So it can take some time. All right, but let's get an epidural going. So this is probably hard to see, but this is actually an epidural catheter. This is a real thing. And we're just gonna put it here on her back. And I'm just gonna kind of hang it over your shoulder, because after they place it, they'll kind of like glue it in place and tape everything so it doesn't move, but they usually do just kind of hang it over your shoulder. And then we have one more thing. Now, because you have an epidural now, everything from her waist down is numb, and you can't feel your bladder anymore. Mm-hmm. And so we're just going to put this on the inside of her thigh there. That represents a catheter, because you do not want to have a full bladder in labor. And so they will insert a catheter to help drain your bladder, they're going to insert it, drain your bladder, and just to help keep that empty and out of the way. So that's the process. There's lots of things.
Yeah.
You kind of said you feel tied down.
Yeah, I do.
Attached to lots of things.
I feel like I can't move.
Yeah, right.
Which I guess is also the point.
That's kind of the point. You're not going to be able to get out of bed. at that point. But there is, I just like people to understand that there's a whole process that has to happen.
Right.
And
Yeah.
yeah.
Well, I think it's important too, because it's not that we're trying to scare you or talk you out of an epidural or anything. It's just knowing. I think it would be more scary if all of a sudden they're hooking you up to all these things and not understanding that each of them has a purpose and has a point, and it's all part of the process of getting an epidural, like as a whole. So,
Yep.
yeah.